All right. Hey, folks, welcome back to another episode of The Changed Physician. This is your host, Dr. Kevin Cuccaro, with my fabulous co-host, Dr. Melissa Cady, for another episode of, our podcast here. And I wanted to start off this episode, and I was thinking that we can have a discussion on a quote. And what had happened is I have lots of quotes, and I have lots of things I've written down. I have like stacks and stacks of index cards with stuff written on them, a lot of them quotes. But I opened up this book today while I was digging for something else, and this quote just like smashed me. And I'm like, okay, this actually is something we should talk about on the Change Physician because it's very relevant to this transition that we're making into physician development, personal development for physicians, physician development. But it was this. It was, would you like you if you met you? And the provenance on it says Tegan and Sarah. I don't know who they are, but apparently that's what they said. But it really kind of made a big difference to me. It's like, would you like you if you met you? And I had the really unfortunate thing of saying, you know what? I think at times I probably would not like me. So I don't know. What do you think? If you met yourself again, and you don't know that you're you, that's the kind of where I'm coming from. So they don't look like you, they whatever, but they're basically you as the person, how you interact, how you think, how you approach somebody in a social situation, kind of how you react, that kind of interaction there. Would you like you?
It depends.
Okay.
I would say, I guess you're going to put me on the spot first.
Of course.
So I think there's some things about me that are annoying. So it depends what you value. So if someone that's, I find this in my professional world, that if you value patient safety, if you value patient experience, quality of care, and all of those things, and your focus is on the patient, then you can appreciate and understand where I'm coming from and why I practice the way I do. I maybe a little bit of particular. I'm particular about things and I have a reason for it, which doesn't always resonate with people that aren't as particular. So maybe a little bit of micromanaging, not maybe, there's a little bit of micromanaging when it comes to me being concerned about the patient. And so those things can be annoying, especially if I've repeated myself, which I know I probably have, but I just want to make sure that what I need done or what I want done is going to be done. So that part in the professional setting is one thing. I think some of the problems with being so focused in the medical world and all of our training is that we've been so used to working, and it's not uncommon to be kind of like workaholics, that you are not as skilled in other realms of your life, such as, I'm not great at small talk. I don't mind talking. I think it's always been awkward for me to initiate small talk. Like I can participate in it, but initiating it, I think I'm a fairly nice person, probably nice to people that don't deserve it. So, but I think that it might be awkward for the other person because I'm not engaging in the small talk if that's their thing.
So it'd be awkward for if you met you would stand there awkwardly with each other because you wouldn't know how to introduce that conversation. And would that make then reflect that you didn't like you?
I think it's just people wouldn't get me. I don't think I would understand them.
Because remember, it's you.
Yeah.
On you.
Yeah.
So is that important?
I don't know, but I'm like coming into it not knowing that person, which is me.
Yeah.
Right.
Yeah.
I would say that it takes some energy to like it. I think if I came to it, of course, if I knew her, like I would understand the person. But I don't think people, like if you're serious all the time at work, it's hard for people to understand the other side of you if you don't share that. And if all you talk about is work-related stuff or pain or things that we get passionate about, like I've been passionate about in the past, because obviously I was passionate enough to write a book. You kind of have to be a little nutso to like be that focused for that long. And in a good way, I feel like passionate about it. But I think that I would be it would be a struggle for someone that's meeting me that doesn't understand all the other parts of me, because all they've seen is maybe what I talk about or my work stuff.
Yeah.
Does that
I
make
guess
sense?
I guess what I'm trying to get at though is you don't know that they're you, but they're you, right?
Yeah.
And so, because you said it's like, oh, talk about pain. I'm not sure if they'll like that. Well, if I met myself and I didn't, it was myself,
Yeah.
and the person wanted to talk about pain in the same way that I was talking about pain and my interests around pain and understanding pain as an experience and kind of the cognitive science behind it, I would like that. Like, I would have no problem there. I'd be like, this guy is freaking awesome, and I want to be around him all the time because that's an interest of mine.
Right.
But what I wouldn't like, the times that I wouldn't like me is some of the things that I do in interactions. So what I you know, and I kind of wrote them down earlier, is I'm impatient and I recognize that. And I don't have a thing against people that are impatient, but if I met me in one of those periods that I didn't then, you know, you talked about the small talk. I don't like small talk either. But if I got impatient, if I was presenting myself in a way which I'm almost dismissive because I want to get to something, whatever, or I just think this is sort of what a lame conversation.
Yeah.
I wouldn't like that, right? Because, you know, I wouldn't like being on the other end of that. And I know I do it. Like, I know I do that. Or the other thing is, I think if I have a tendency to be judgmental. I know that's shocking. But then approaching somebody else who I don't know, like the whole thing that really bugs me about the idea of being judgmental is the fact that you truly, most of the time, you can't judge because you don't truly understand where that person's coming from. You don't know what their experience are. And then to flatly say, based on a 5-second conversation, if it was me, to come to be judgmental and then just kind of dismiss the person, to find that there's nothing worthy of talking about, I wouldn't like that. And yet I know I do it to people. Or you know, impatient, short-tempered goes together as well. As I have a tendency to become, I guess, you know, all focus back. I can be very, very judgmental. And I think like what that quote brought out in me was the fact that I don't like judgmental people. And yet I am judgmental. And so if I ever met me, there's a chance that if the interaction was just how it was set up, that I wouldn't like me. And that was very disturbing. Right. And so and I think that's the power that allows you to step back and identify these things about what are things that you do that you were aware that you do that you wouldn't tolerate in somebody else. And yeah,
like anyways, forgetting names.
I don't mind that at all. Like forgetting, it's not a big deal. Like in what that would make me do, because I forget names all the time, is what I should do is I should feel comfortable admitting that I forgot their name, because that's what I don't do. Is I'm like, I don't remember what your name is, and then I just kind of blow over it, and then it's like 6 months later and I'm still like, I don't know what their name is. That gets uncomfortable. So I guess if that came up in me and we just didn't even know each other's names, then we'd be doing the song and dance about, hey you, hey guy, you know, that kind of thing for a long period of time. But that doesn't necessarily turn me off. It's the things that man, I just know I can be judgmental, and people, for whatever reason, they because I've had interactions with people for whatever, something just clicks, not in a good way. And then I just don't even want to deal with them. But I haven't really given them the space in order for me to actually make that decision in a way that makes sense. Like, no one in this world is going to be, you don't have to like everybody. In fact, it would be ridiculous if you do like everybody. You don't have to be perfect all the time. Nobody's perfect all the time.
Right.
But I think inherent in that quote for me is recognizing that in order to be a good person, or at least the person that I kind of internally see myself to be, I need to be willing to listen to other people more. And instead of making those snap judgments, be able to take a time to actually listen, to reflect, to kind of find what is in them that perhaps that we can connect on, rather than immediately saying, this person, I don't even know why they're talking to me, kind of a deal. Yeah. So it was sort of very disturbing for me to kind of have that conversation and dialogue about, well, would you met Kevin in a social situation? Are you going to like him or not?
Yeah.
Yeah. Anyway, so that's what I was trying to get at is kind of those self-introspective reflections about what are you seeing as a flaw in you that maybe perhaps you wouldn't like in somebody else. So if we don't, that's the hypocrisy part about it as well, is if you don't like it in somebody else and yet the flaw's in you, then either you need to work on that flaw within you and or switch it so that is no longer something that you are not tolerating in somebody else.
So I've come to terms with what I need to say. Before I get to that, let me just say it's very obvious that as humans we can get caught up in our head, and it's easy to forget people's names, especially if we don't make a point to connect it to a prior person that had the same name or something that describes them, or something, an anchor, in your own head to help remember it later, and or reprocessing and thinking of that experience of meeting them, and so it kind of cements it in your mind better. So how much time we put into our interactions and meeting people, and not being selfish but really thinking of them to help reinforce it, is probably a good lesson there too. But I think the thing that I wouldn't like about myself is this propensity, not always, I'm pretty aware of it, pretty cognitive of it because of my own family, is this desire to be right and correcting people. Mm-hmm. That's probably the most annoying thing about me that people or I wouldn't like about myself if it's done to me. Sometimes I even apologize after I do it. Like I'm like, this is like, even when I read things that are, professional materials that are a colleague or a friend of mine, like I can't help myself. Like I feel like I have to correct it and say these are all the typos are, which from a professional standpoint, they want that because it's for their patients or something like that. So I try not to correct if it's not like influencing their, business or something. But I think that's the part that if people, and they may not put it into those words, but maybe just that I'm serious at work or whatnot, but even in my personal realm, there's still that desire to, like, especially as a teacher, it tends to be a teacher and I don't want to call it fixer, but being in as a medical professional, it's sometimes you feel compelled, even when you hear things that are so off base, like you feel compelled to offer free advice essentially, like unless they're asking you for it. Like sometimes I tell myself to shut up and just be like, you know what, if they don't know what they don't know, and unless it's like gonna really harm somebody else, I'm just like, sometimes I have to just let it go. Would that be a good example of
I think that's question? A good example. But there's a huge spectrum of it, because the first thing I was thinking of was like the grammar Nazis, right? I'm like, yeah, that would totally make me annoyed too. But yeah, anyway, because it's on a spectrum, because then there's stuff, if someone can't write a complete sentence, then it's like, ooh.
Well, yeah. I mean, one thing if you're hiring somebody and you just notice certain things are required of the job, and that may not be a good person to fill that job. Yeah. I mean, I don't correct like grammar on every, like emails and stuff, like, I mean, there could be typos because you're doing it on Siri or something. But yeah, no, that would be my number one thing that sometimes you don't want to think about, but it is a problem. But when you're doing it, you're like, I'm aware of it when it's happening.
That's good.
Yeah, but either I apologize right after I do it, or minimize, try to like downplay it in some way and not make them feel bad. Because the thing is, people aren't going to want to talk to you if you're going to be corrected all the time. My husband's really good about reminding me of my things I need to work on too. So Grateful for that. I mean, because we do it back and forth to each other, so it's not like it's one-sided. We have different issues, but yeah, this is almost like people are listening to like almost like this counseling or some kind of like therapy session between us.
I don't think it's a session, but I do think it's useful, right? It's a useful exercise now that I think about it, is to just kind of consider, if you met you, would you like you? Because and then from a physician standpoint, if you met you as a doctor, would you like you? And that becomes incredibly relevant to our careers in, because I think about you can never be the perfect physician all the time to do everything that we know and we want and we know is correct.
Yeah.
But you can certainly make the effort to do it. And I do think that at times we particularly in a service-oriented profession like physicians are, we tend to forget that. And that really decreases the those interactions. And it kind of annoys me because, the whole special privilege thing that people do. And healthcare is so bad now. Like, I don't like it, but I'll do it. Like trying to well, who should I see? Who would you recommend? Because, there's really thoughtful people. Or this is the other one that just drove me crazy, is there's people that you're like, that your colleagues, and I'm thinking of, this was way back when, couple clinics ago, that they just drove you crazy. And then the way they did things, and they're 5 hours behind or whatever. But then if you had to go to somebody, that's the person you would pick. Like, that's the person you would send your family members to. And again, that pulls out this level of hypocrisy of, well, oh, wait a second, that drive me. Who would you want to be as a physician? Who would you want to send your family and family members to as this person? And yet you're upset at them because they take a long time, they're behind all the time, whatever. And I don't know. I just think it's a very useful reflection that we can do as individuals, and we can do as in whatever your industry is, certainly within medicine itself, is just to ask that question: is would you like you if you met you? Would you like you as a doctor is if you met you as a doctor? And again, in with a little bit of compassion, obviously, because we're not perfect, but also recognizing if that's true, then maybe we need to work on it. Right?
Yeah.
We need to actually change that, rather than just say, well, that's me, or, all that other kind of goofiness that people do.
It's the way it's always been. Yeah, no, I was just thinking today or yesterday about how we interact with, because there's so many patients that have these like lifestyle habit problems. And many times in my anesthesia world, so I've learned this the hard way, and, I've been criticized from, prior people I've worked with. It wasn't very often, but it's sometimes, it's weird, because I learned the hard way that when you realize there's some major problems, whether it's an obesity, nutritional, diabetes, you should do this, you should do that, and that kind of thing, or trying to offer this guidance out of your intentions are good, but you haven't connected with the patient like the surgeon has, even though it may not be that long-standing of a relationship. There's this elevation of trust that they've already agreed to have the surgery, and they are not there to get your, encouragement or suggestions, or I don't want to call it, going on a diatribe and like lecturing, but you're trying to do it in a way that's, you hope they receive it well, but the problem is it gets back to the surgeon that you annoyed the shit out of, or sorry, but
we have an explicit rating on iTunes for some reason. So
oh, do we?
We do. I'm like, I have no idea. It always says there's a little E for explicit. I'm like, we don't cuss on this thing. How did this thing get flagged? But,
yeah. Well,
it was waiting for you to say that. So yes, Melissa's the potty mouth, guys.
I was just like, I'm sure that's what patients are thinking. Like, they're trying to be nice, and they're just like, I don't want to hear this right now. I'm not ready. I'm not, and so I haven't made these connections with these people. And so these chronic ailments and problems that are so complicated, like thinking about, would they like, and it's not just about liking, but appreciating or valuing the care from a physician. Like, there's moments they probably didn't like me. And you're not, obviously there are people that do stuff that's really harmful, and you're trying to tell them why you're concerned about the anesthetic you're going to be delivering and whatnot. And you have to be honest. And so you're not going to make them all happy. But I do think that it's good to reflect on perhaps why maybe it's met with a lot of resistance, and your methods may not be appropriate for that situation, or you need a different approach or in a different setting. But I think that's relevant to clinical care. You got to think about what kind of problem is this? And this is not going to be a one time you tell them, unless you scare the living daylights out of them. They had a heart attack and they're going to die if they don't change their life. But
well, you can use that quote though in that situation is like, well, if I was this person in this situation, would I want to hear what I think I'm going to say?
Yeah.
And I think that empathetic kind of communication style, or at least it's almost, I'm going to call empathetic awareness, is missing in a lot of ways. And I do, it's a good exercise to do. It's just to take that moment in time and think about who you are. And if you met you, and not to take we should probably end this pretty soon, but the other flip, I just thought about the other side of this is if you happen to be somebody who beats yourself up all the time, is to be a little bit aware of that. Like, you may actually like yourself a lot better than you think others like you, because there's much more for you to be that people are seeing in you that you are not being appreciative. But should probably save that for another episode.
Yeah, I think so too. Well, very good. So would you like you if you met you? I guess, was that the question?
If you met you, would you like you? Yeah.
There you go. Well, I think this is a good exercise for, it's a very different kind of episode for us to talk about, but I think it's good for people to hear us, discuss some of these, I guess, realities of ourselves that are not always something to, brag about, but really help us reflect on, our own personal development and our own interactions. And I've had a few conversations too with other people that these are really important for us to take our own our lives to another level. And we always talk about, in this podcast, the Change Physician podcast, how to live a more fulfilling life, whether it's personally, professionally, and they all kind of bleed together sometimes. But thank you all for listening. I would love to hear any feedback or comments. Feel free to go ahead and subscribe to the podcast on all the different venues that are out there, or you can join the community at thechangephysician.com, whether you're a physician or a physician ally. We'd love any feedback you'd like to give us, and you can always reach out. I'll just say your email, kevin@thechangephysician.com.
Dr. Kevin at thechangephysician.com.
Oh, sorry, Dr. Kevin. So Dr. Kevin at thechangephysician.com. I've been corrected again for that. But we look forward to seeing you on the next episode. Y'all take care.
Take care, folks.